Patients continue to bear the brunt of a standoff over debts owed to the private and faith-based health facilities by the now defunct National Hospital Insurance Fund and claims management by its successor, the Social Health Authority. And while Health Cabinet Secretary Dr. Deborah Mulongo today told the Senate that engagements are being held at the highest level to resolve the deadlock, senators question her ability to withstand the pressure of the office she holds. That story will be shortly with us here on the broadcast by Olive Barrows. And still on this, we have that story, and here is that report by Olive Barrows, who begins our broadcast tonight with that story.
Confusion persisted on Wednesday, with patients unclear whether the health facilities that they visit would accept the national health insurance governed by the Social Health Authority or would be required to pay out of pocket.
Ningeomba muweze kutusaidia insurance ya SHA iwe kama NHIF.
From Kisii to Kericho, patients could only hope that their preferred health provider would not require them to pay out of pocket despite having registered for the Social Health Authority insurance cover.
Tumejaribu karibu hospitali karibu mbili Kilgori simekataa SHA, wanahitaji tu cash.
While health providers say they are willing to meet patient demands, they maintain that they're confronted with fiscal constraints, government facilities included.
Like as of this moment, we have had to suspend the service, not because we are not willing to give services, but because of the pressure. Once patients come here, they expect drugs in stock. They expect lab reagents to be in stock. Okay? They expect to find staff enough to work. Okay? But now that requires money. Money which we expect out of the reimbursements. Reimbursement which is not forthcoming.
Health Cabinet Secretary Deborah Mulongo did not have an easy time of things when she appeared before the Senate on Wednesday to answer questions on a raft of issues, top among them the Social Health Authority.
We passed those four laws, Mr. Speaker, knowing that SHA was going to be transformational and change the lives of Kenyans. Do not sit in your office, Madam Minister, and listen to your choir of office officials. Come and listen to the representatives of the people to tell you the challenges that people are facing.
Now that the President told us that if we remove that capping, that if all of us pay according to our abilities, we will end the spectre of harambes to raise money for healthcare in this country. Can the Cabinet Secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a harambe for this weekend? If she cannot confirm, then she should be gentle enough, she should be kind enough to tell us today that this thing is not working.
I wonder how she's going to manage this ministry. And I don't know if she has thought of even resigning.
In the midst of the firestorm that rained on her head and that of the SHA CEO, Robert Ingasira,
private and faith-based health facilities are withdrawing from the SHA for reasons of funding, release of funds to the facilities. I saw yesterday the CEO make a very irresponsible statement saying that there are only 300 facilities, so even if they disappear, nothing will really change. Madam CS, that statement coming from your CEO, Madam CS, I would have expected a rejoinder from you immediately to say that you care if you do.
Mulongo stayed true to script.
In various countries, you observe that they raise concerns and grievances, first of all, on waiting time, second, on the system interruptions. So this is a common issue.
But even as she gave this assurance,
we are talking to His Excellency the President. Again, we have talked to the Treasury, and now we are also requesting for your support, to ensure that we are paying the NHIF bill.
Olive Barrows, Citizen TV.